Hello and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service, and Multicultural New South Wales. Thank you again for joining us this afternoon. We're so pleased that we have Dr. Jeremy McAnulty joining us. He's Executive Director of Health Protection New South Wales, and he's joined us again to answer your questions on public health matters, mostly on COVID-19, Japanese Encephalitis Virus, and the poppy seed matters. So we'll have all your questions answered today. We have 30 minutes, and we hope you can put them on the chat for Dr. Jeremy to answer. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respect to elders past and present, and also acknowledge the land from which we are all meeting from today, and also for Dr. Jeremy and myself and our team here at the Ministry of Health. We are joining from the land of the Camaragal people of the Eora Nation. We'd also like to acknowledge the elders and leaders of multicultural communities represented in this forum today. As I said, we'll try to do our best to answer your questions in 30 minutes. So please, we appreciate you putting your microphones on mute and also putting your questions on the chat. We want a lively discussion, so share your thoughts with us today. My colleagues and I from the Multicultural Health Communication Service will be putting links on translated resources and programs that are available on public health matters and COVID for you to share with your communities. We'll now start with an update from Dr. Jeremy. Dr. Jeremy, how are you?
I'm good, thanks, Jess. How are you?
Good.
So with COVID, as people are probably aware, we're seeing an increase, quite rapid increase in the last couple of weeks or so of COVID across Australia, including in New South Wales. So it's driven by variants, not just one or two variants, but a range of variants. These are mutations of the COVID Omicron variant that emerge. So there's this ever ongoing battle between our immune systems as people and the virus mutates to get around our immune systems. And that's what seems to have happened. These new variants have mutated in such a way that they're more readily able to infect us, even if we've had vaccination or infection in the past. Now, the vaccine still protects you from severe disease, though. That's the important thing. So it's important to make sure you're up to date with your vaccine, and to help prevent transmission, to do those simple things we learned about before, like wearing a mask where you can't isolate from other people, particularly indoors. If you're sick, stay at home, get a COVID test, check in with your doctor if you test positive in case you need antivirals, particularly if you're at risk of severe disease. Good hygiene.
And Dr. Jeremy, I think what you're saying is these are the practices that we've learned before, and especially now, just for everyone's information here at the ministry, for Dr. Jeremy and I, we're putting our masks off for this purpose of this session, for clarity of our messages. But right after we put on our mask just to keep safe, and he's got his mask right there. And also, I think in terms of the increase of proportion of cases, there's been some questions about rate of hospitalizations that's gone up.
Yeah, so typically what we see when we see a new wave, an increase in cases of COVID, there's a delay of a week or two before we see the more severe effects coming into play. So that typically follows. There's no indication that these variants are more severe than previous variants. And, we're hopeful over time that as the virus mutates, it might become less severe, but we're not really seeing that at this point. So it's important to make sure that we're up to date with our vaccines. While it mightn't protect us very well from getting infected in the first place, will for a few weeks, that wears off, it still protects us from getting severe disease.
Dr. Jeremy, there's been some questions from our presentation last week, last fortnight, when you talked about long COVID and possible cases. A question from Fat and Dana, one of our listeners from Radio 2 MFM, has asked, can children have long COVID?
Yeah, so long COVID can affect anyone. Fortunately, most people don't get long COVID, and most people recover without problems. But some people can get ongoing symptoms, weakness, fatigue, feeling tired, feeling foggy, sometimes some palpitations and things. They typically resolve, but we're still learning a lot about long COVID. Importantly, most people recover without problems, but some people seem to have this ongoing symptoms that can last some weeks or longer. So best check in with your doctor if you're getting those sort of ongoing symptoms.
Like the symptom of loss of taste or smell that could depend on the individual as well, isn't it?
That's right, and that's seemed to be more common with earlier variants of COVID. Less prominent these days, but can still occur. So when the virus mutates, maybe it has some slightly different ways of presenting, but individuals react differently, largely due to their immunity, whether they've been vaccinated, whether they've had infection before, and perhaps how much dose they're exposed to in the first place when they're exposed to the virus.
Thank you for that. There's a question as well on what kind of support is available for people who are over 65 and needs care.
Yeah, so we've got this fantastic system where when you register your test, either a RAT test or it's done automatically if you have a PCR test that's positive. So if you have a positive test, make sure it's registered if it's a RAT test. And then that links you automatically into the health system. You'll be sent advice and a short questionnaire to help figure out if you're at increased risk of severe disease. And then plugged into your GP, or if you don't have a GP, there are ways of plugging you in to health services to make sure that if you do need antiviral therapies, which are effective in reducing the bad effects of COVID, then you can make sure you're plugged into care. So it's really important to register those results of any RAT you have.
But there's also a question about, for those people who have not had COVID, should they ask for prescriptions for antiviral medication in advance from their GP?
Yeah, no, it's important to have a plan with your GP. So all of us, particularly if you're one of the vulnerable people, so older people, people with underlying immune problems or chronic conditions, check in with your GP before you get any symptoms, before you have COVID. So you've got a plan for what to do. Ideally, your doctor may be able to give you a form to get tested with, or you just go along to one of the clinics, make sure you've got enough rapid antigen or RAT tests at hand so you can get a test if you get symptoms, and then work out with your doctor, and it depends on what other conditions, illnesses you might have, what type of, whether you need antivirals if you get COVID, and secondly, what type of antivirals you need, because there are two main types and others as well. So having planned in advance means that you can get treated much earlier. And because we really want people to be treated as soon as possible after their onset of symptoms. The longer you wait, the less effective the medicines can be.
Yes, that question came from a community member that said that they tried to do that test, trying to get prescriptions for antiviral in advance, but the GPs were demanding a positive test.
Yeah, that's right. So these are, drugs that we need to reserve for the people who need them. That's people who are at risk of severe disease who have COVID. So we don't give them out in advance, but that's why it's important to have a plan with your doctor about what you need to do, whether you're suitable to have antivirals, because not everyone is. If you're otherwise young and healthy, you are unlikely to need them. Have a plan with your GP about what sort of test to do, how to get that test, what sort of, if you test positive, what you need to do in terms of getting treated.
Now, you said about keeping yourself safe, and vaccination is one of those things, one of the most important things to keep everyone safe. But were people, if they are up to date with their recommended doses and they want to get another one, what do you say to those people?
So we rely very much on the advice of the expert federal committees. So in Australia, we've got some fantastic expertise in terms of COVID and vaccination called ATAGI, and they look at all the evidence around the world and figure out what's the best settings for vaccination, because you don't want to over-vaccinate people and you don't want to under-vaccinate people. You want to hit that right spot. So the current recommendations are 4 doses of vaccine if you're over 50. If you're over 30, you need at least 3, but you could have a 4th if you'd like. So the ATAGI, the expert advisory group, look at just what the right settings are and what the right level of vaccine is for our general immunity in the community. Some people, if they have got severe immune conditions may need extra doses as well, but talk to your doctor if you're in that category.
Thank you, Dr. Jeremy. And in terms of influenza and, having COVID around and the flu, is there a high level of influenza around?
We did have a high level of influenza. Remember, we had 2 or 3 years with no influenza at all because of the COVID restrictions. And then earlier this year, I think it was around May, but earlier in the year, earlier than we would expect for the winter flu season, we had quite a sharp increase in flu cases, but that then subsided and we haven't seen large numbers of flu. So flu's not really around at this point, although it's always a risk if people have travelled overseas and might have been exposed to somebody with the flu who's brought it back.
Yeah. Yeah, that's very good. Thank you so much for answering those questions. We will also tackle some other issues. And this is what, at least influenza is not around, then we can say, okay, tick that, it's not. But there is JEV that is quite prominent right now. And it's something that could be a concern for people.
Yeah, so JEV, or Japanese Encephalitis Virus, is a virus that we haven't seen in most of Australia before, except it emerged earlier this year, last summer. It usually lives and infects people in parts of Asia, and it has done for many years, but probably to do with weather and climate change, it's worked its way through mosquitoes and probably through wild birds down from Northern Australia down into New South Wales and Victoria and South Australia. It's spread by mosquitoes. So you can't get it any other way other than being bitten by mosquitoes. And it's the highest risk areas are in Western New South Wales. So west of the mountains, probably the further west you go, the higher the risk, but particularly around the rivers. So the Murray River, the Murrumbidgee River, the Darling River, around those western rivers is probably the highest risk areas. So people may be aware that mosquitoes in New South Wales can carry a range of infections that people can get from those mosquitoes. Japanese encephalitis is a new one, but we've had Murray Valley encephalitis, which causes similar symptoms. Kunjun, Barmah forest virus, and Ross River virus. People may have heard of those. Those last two, Ross River virus and Barmah forest virus, give you an unpleasant disease, but it's not fatal. It's often a rash, a fever, and joint pains that can last a few weeks. Most people don't need to be hospitalised for those. But Japanese encephalitis and Murray Valley encephalitis can give you, most of the time, you don't get any symptoms. You never know you're infected, but less than 1 in 100 people can get a really nasty disease, which might end up in seizures, fitting, brain damage, and even death. So they're nasty but rare, and certainly worth avoiding. The way to avoid all these infections is to not get bitten by mosquitoes. Mm-hmm. So that's easier said than done, yes. But put into your daily routine, covering up when there are mosquitoes about, whenever you go outside, but particularly important when there are mosquitoes about, wear long sleeves, long pants, shoes and socks, and any exposed skin, use insect repellent and reapply it according to the instructions. And then make sure your house is safe. So make sure there's fly screens in all the doors and windows and don't have holes in it. And get rid of any little pots or rubbish that might allow water to collect, because mosquitoes love to breed in those water collections. So fix up your house, protect yourself from being bitten, and just do that on a routine basis daily. There is a vaccine for Japanese encephalitis. It's restricted around the world. There's not a whole lot of vaccine made around the world. It's usually made for those Asian countries. We've been able to, with the federal government, get some for New South Wales, but not a huge amount. We've got something like 50,000, and we're rolling that out for free to people in those western parts of New South Wales, along the rivers, south and north western parts, who spend a lot of time outdoors, who therefore might be at increased risk of getting bitten. It works against Japanese encephalitis, doesn't work against those other viruses that mosquitoes carry. So you need to do all those things to protect yourself.
Dr. Jeremy, if you had been bitten by, this is maybe a stupid question, but if I was bitten and I had symptoms and I have family members, would they be catching my symptoms, or they also need to be bitten? Is that the case?
Yeah, so you can't spread, if you've got Japanese encephalitis, you can't spread it to another person.
Like COVID, yeah.
Yeah, so the mosquito needs to bite an animal that's been infected, usually a water bird, and then bite you, and then you get it, but you can't pass it on to other people.
That's very important to know. We have health workers also joining us in this session, and I think that's important for health workers to be able to share that information to people. So with all this water, it is important because now holidays are going to come up, Christmas holidays, kids are going to be around and about. So, and parents would like to take them out. So the best way is to keep them wrapped up, at least if there's mosquitoes around.
Yeah, so just to those simple things, like they're simple, but you have to remember to do it. So sort of mentally and make a list for yourself. Buy some repellent or get some repellent so that you've got it readily available. I've got some and I keep it near the front door, and then when we go out, we apply it. So we have that visual kind of remember to do it. So apply it on your kids, but the long sleeve, long pants, covering and any exposed skin, use repellent and reapply it. It's particularly important if you're camping or fishing along the rivers, but any time outdoors when there are mosquitoes might be about.
Thank you so much, Dr. Jeremy. And there are resources available in languages and in the specific languages that in some areas, and as you said, it's regional areas that are of concern. Dr. Jeremy, also there is that national recall of the poppy seed, and which has caused a bit of concern for some people.
Yeah, no, it's an unusual situation, but these sort of things happen from time to time. So we receive reports of a small number of people. I think it was 13 or so in New South Wales and in other states, of people who got quite severely unwell and often required hospitalisation with severe muscle cramps and muscle spasms and abnormal movements and even seizures, and in one case a cardiac arrest. So nasty symptoms. And the thing that they had in common was a few hours before they'd consumed large quantities of poppy seeds in a tea brew. Now, people sometimes brew poppy seed tea to get special effects from it. So it appears that these particular poppy seeds had been sourced from a source that wasn't meant to be for food. Now, poppy seeds normally are fine to eat, and we eat them all the time in cakes and bread and other things. But it seems like there was a particular problem with a few batches sold by different companies, but coming from the same original product that had a high level of particular toxin in them. So that it wasn't meant to be for food consumption. They were grown for other purposes, got into the food chain, and then when people drank or used high quantities of them in a tea brew, they had these impacts. So those poppy seeds have been recalled, withdrawn from sale. You can look on the website, including on the TGA's website, for the particular batch numbers and brand names. There are several brand names involved of those poppy seeds. And if anyone has those at home, take them back to the point of sale or throw them away so that people don't eat them. The cases reported drinking this tea, we don't know it's safe if you eat it in other ways. So just check what poppy seed brand and batch number you have it in your cupboard, check on the website, and then if they're one of those affected areas, just don't consume them.
Thank you very much, Dr. Jeremy. You've seen all the links on the chats. If you have any questions, please let us know. I do have a question about poppy seed. What about other seeds that we may be using for our tea, for our cakes or other food products that we make and bake? Should we be worried about that?
At this point, no, there's no concern for other types of seeds. Poppy seeds are often grown. I don't know much about poppy seeds, but some are used for food and some are used for other purposes like medicines. And so when they get mixed up that's where the problem was. But for other seeds, there's no indication of there's a particular problem for any other seed.
So it says that if you do have any problems, please contact the New South Wales Poisons Information Centre. They're available 24/7 on 131126. That's 131126, and they can provide more information about poisons and what to do in suspected cases of poppy seed poisoning. Dr. Jeremy, in terms of feeling safe and in terms of getting informed, what should the people do? Because there are a lot of news about health matters that's come on. Where do you get the right information?
And there's a lot of misinformation too that is out there, and so people just need to be cautious about where they get their health information from. There's a lot of social media channels and people, for reasons that may not be pure, might put information out there that's just not right. And so it's always best to check in with reputable websites, including, the government websites, newsouthwales.gov or New South Wales Health website. Don't believe everything you might read. But when there's a concern about safety of a food or other product, then there are established government processes that kick in and then provide information out to the public.
Dr. Jeremy, going back to COVID-19, and given that the holidays are coming up, the end of season, people are excited, but are worried. What do we say to the community?
Well, I think, we just need to, it is hard. We've been through a hard 3 years with COVID and learning to live with it. And sadly, some people have died and some people got very sick from it. And so we have to remember what we've been through, but also that now we've got, unlike the early days, we've got these fantastic tools. We've got vaccinations that are very effective in preventing severe disease. We've got antivirals that are very effective in preventing severe disease if you get infected. And we can all put in place plans with our doctors about what to do should we get a positive test. So I guess what I do is I try not to worry about it. I take those simple precautions. I use a mask when I'm not able to keep a distance from other people. On several occasions, I've stayed at home and got a test until I test negative and work from home. I do that, and it kind of works because we've now set up our offices to work from home. And then I, take sensible precautions. I try and entertain outdoors where it's fresh air, and COVID is one of those things in life that we have to just I guess manage and get on with, but not get overly concerned about it. There are many other things that are in life that we need to be able to manage. COVID is now kind of one of those things that we know how to manage, and if we have a plan, we know what to do. I think that's reassuring to myself and hopefully to other people that it's it's not the unknown anymore. We know a lot about COVID, how to manage and how to prevent it. And I think,
Dr. Jeremy, when you're saying have a plan, I used to have, and that's what we used to advise people, have a little bag where you have a small kit, and maybe the same thing for Japanese encephalitis as well as, for other matters, just because, you could be safe by doing that and helping your family as well.
Well, exactly right. So like, as we talked about before, if you live in an area where there's mosquito-borne infections, have a plan for making sure you cover up and put on repellent every day. We should all be putting on sunblock every day when we go out. We have a plan for that. Have a plan for what to do if you get symptoms that might be COVID and how to manage that with your doctor. So yeah, I think if people know what to do and have information about what to do, and you can find that hopefully on our website, then it's reassuring, I think, for people, and provides an action for people to do.
Dr. Jeremy, one of those things as well is because of the new wave and there are cases rising, how are we keeping our health workers safe as well?
Yeah, so recently with the new the wave increasing, the health department, the Ministry of Health, put out advice to all health facilities to now all patients and people across the health facilities should wear masks, and that was one way and monitor visitor numbers so we don't get crowding in the facilities. So they're simple things that I think now we're pretty much used to wearing masks in those situations. Gives us an extra that masks do work in preventing disease spread. So, those, again, little things that we just routinize when we see the risk level in the community increasing, and when that decreases again, then we'll change that advice. So it's important that we keep our health workers protected, because they're our front line protecting all of us in the community from COVID and a range of other infections and diseases.
Yeah, and Dr. Jeremy, there are a lot of tools around as well to keep everyone safe. If you don't feel like going out, if you're unwell, you can contact your GP or your healthcare provider, and using other services like telehealth or virtual care.
Yeah, well, exactly. So again, using my personal experience, I've in the last couple of years had a doctor appointment, called up, made an appointment, done it over the phone. It was great. Got some scripts for what I needed. If you don't have access to a GP, you can call up the Health Direct line, and they have a service that can give you advice and even plug you into GPs if need be. So there are a range of things that we didn't have 2 or 3 years ago before the pandemic that are now here, and they're great. They really are useful in keeping people plugged in and to services that they wouldn't have otherwise got.
And also language support available.
Yeah, look, we've got some fantastic translation facilities that people can use, and it's important that we all use them.
Dr. Jeremy, from your experience now, having been, it's been 3 years, almost 3 years now. What is, from your perspective, having gone through this and doing the updates, from your personal experience, what have you taken from all this to the community and yourself?
I think communication is so important. So I think the work that the media have done, and including the social networks and so on, have been just so important in getting information out. As you said before, making sure we're reaching the range of cultural communities that we have, to make sure we're in language and appropriately culturally getting the messages out, working with community leaders. Looking after each other in communities is just so important. We're not alone. In fact, we know these infections spread amongst people, so we depend on others to keep us all safe. So we're part of a community, and that community needs to work together to keep everyone safe, if you like.
And Dr. Jeremy, would you say that it's good to also have a plan at home? When, if cases and situations we used to have isolation, but having that plan available to keep your family safe. But some people in some communities have more than 5 people living together in a home. So
yeah, look, some people live in luxurious accommodation with 3 bathrooms and 2 people in the house, but others have 20 people in one house and share a bathroom. So people's circumstances can be quite different. And so it is important that the family get together and figure out what they'll do should somebody get symptoms, should somebody test positive for COVID, how they'll cope, how they'll isolate and work together. So talking through beforehand, it's never good when you kind of plan things you haven't planned and you don't know what to do at the end. So seek advice, look on the various websites, talk to your doctor about how you might plan for it.
Thank you so much, Dr. Jeremy. And we have run out of time. It's 4:30. So thank you so much for joining us. Dr. Jeremy, any last words?
No, just thanks very much again for the opportunity. It's really important work that you all do.
Thank you so much for all the health workers who've joined us, as well as the media. Thank you for always coming online every fortnight to listen to answers and updates on health matters, public health, COVID-19, and other health issues. If you have any issues or matters on health for the community that's concerning your community groups, please let us know, and we'll try to feature them or showcase them and highlight them and answer questions. Thank you very much for joining us. The recording of this session will be available on the New South Wales Multicultural Health Communication Service website, and we'll also share them through email. Thank you so much. Have a safe day, and we'll see you again next time.